For many people dealing with mental health issues, to explore using cannabis as a treatment seems overwhelming because of two stigmas. First is the stigma of their condition to begin with. And second is the stigma still lingering with medical cannabis in some communities. How can we reduce these stigmas? And what do patients with mental health issues need to do to begin that exploration? Welcome to the Dispense Magazine podcast. I'm your host, Sven Hosford. In this episode, we bring you a panel discussion from a recent Mind-Body Expo that explores these questions in some depth. Our panelists include Sara Makin of Makin Wellness in Pittsburgh. Her practice provides diagnosis and treatment for many mental health conditions, and especially anxiety and PTSD, which are now qualifying conditions in Pennsylvania. We'll talk to Richard Greer, Pharmacy Director for Solevo Wellness, a dispensary in Pittsburgh. And we'll hear from Chad Rodman of Medical Marijuana Solutions, which provides patient certifications in many locations across mid and western Pennsylvania. He's also a patient who treats his anxiety with cannabis. Here's how it sounded on September 28th, 2019. Welcome, everybody. My name is Sven Hosford. I'm the founder and publisher of Dispense Magazine, which hopefully you have picked up a copy here today. We cover the medical cannabis news here for Western Pennsylvania and all of Pennsylvania. I come from the world of holistic healing, so I've done holistic health magazines for about 25 years, so it was a natural extension for me to come right over here and start doing the cannabis, because really cannabis and holistic are very, very similar. A lot of the same principles and attitudes. So we've got a very interesting panel for you today. We're going to be recording this for a podcast, so if you have any questions, there's a microphone up here. Again, what we're going to talk about today is mental health conditions, how to get a diagnosis, what the process is, what is considered a diagnosable, basically, and then what happens when you get to the dispensary. And we also have a patient perspective, so somebody who's been down this road and is using cannabis to treat his mental health right now. So let me get started by introducing the panel. Right there in the middle, we've got Sara Makin. She's with Makin Wellness. She has an office in downtown Pittsburgh and New Kensington. And on her left is Richard Greer. Richard is the pharmacist, the lead pharmacist at Solevo Wellness, which is the first dispensary to open up in Pittsburgh and Allegheny County, I believe. And then on this side, we have Chad Rodman. Chad is with Medical Marijuana Solutions. So he is a patient, but he has also got a medical background and is very, very knowledgeable about medical cannabis. So it's a very interesting perspective. So Sara, let's start with you. Can you describe your practice, kind of what kind of mental health conditions do you treat overall?
Yes, I would love to. Thank you for asking. So at Makin Wellness, we specialize in helping people heal and become happy again. We specialize in holistic mental health and addiction treatment. So any form of mental health or addiction condition, we are more than happy to help a person in their healing journey. And we have medical marijuana evaluations and have the only mental health practices in Pennsylvania that have medical marijuana as part of the anxiety, trauma, and opiate use disorder treatment.
And are those are the three main mental health conditions that are the qualifying conditions for Pennsylvania?
Yes, as well as autism.
Autism too, and you diagnosed for that?
Yes, we are able to. We mostly see patients with anxiety, trauma, and opiate disorder, but we do see patients with autism as well.
Is anxiety probably your number one condition that you're treating right now?
Anxiety and PTSD are, yeah.
Okay, great.
Thank you.
Tell us a little bit about the process of getting a diagnosis. What do people need to do? Mm-hmm. Since it's most people who have PTSD and anxiety have never even been to any kind of mental health professional. Is that true?
Yeah, that is true. And actually, this is very unfortunate because anxiety is actually a highly treatable condition. And out of all of the mental health and addiction conditions, it has the best outcomes. So as far as getting a diagnosis, the first step is taking a screening tool. We have screening tools for these conditions on our website at makinwellness.com. And if the screening tool says that you more than likely have it, then you would be a good candidate to have an evaluation done. And For instance, like with the anxiety evaluation in the beginning, we ask, is your anxiety more generalized, or is it something like a specific a phobia, or is it something specific that makes you very anxious? And then based off of that response depends on what kind of assessment we do.
Sometimes people have other conditions that are related to that, like insomnia. Are people using cannabis for that? Have you seen? Or, I mean, they get their card for anxiety or PTSD, but does that also help with things like insomnia and any other mental health conditions?
Oh, that's a great question. Actually, yes. Many patients that have PTSD and anxiety suffer from insomnia or can have a really difficult time with falling asleep. So using a CBD or using medical cannabis at night is very helpful for increasing quality of sleep. And actually, patients that have PTSD, if they have a lot of nightmares at night, it helps to reduce the severity and intensity of the nightmares.
Excellent, excellent.
Yes.
Let's move over to Richard. Richard Greer. Not Gear, don't get excited, ladies. But Richard is, you get that all the time, right? Yes. Richard is really a top-notch pharmacist. So he's been on other podcasts of ours as well. Richard, describe what exactly do you do as a pharmacist at a dispensary?
Okay, so first of all, Sven, thank you for having me.
You bet.
Now, talking from the pharmacist perspective from Solevo as a dispensary, one thing we very much pride ourselves on is very pharmacist-focused care. So we do require, when we see any new patient, that they do actually sit down and have some kind of consultation with a pharmacist. The importance of that, there's many, especially if you're talking any sort of mental health diagnosis. We understand the burden that has on our patients, number one. Number two, we also understand as a medical marijuana dispensary, we're kind of this foreign entity. You know, we're not a doctor's office. We're not a traditional pharmacy. We're this different thing that just off the bat, people are a little bit unsure about and a little bit anxious even to come see us sometimes. We definitely want to take that into account, make our environment as welcoming as possible so that we're in no way, shape, or form worsening someone's anxiety or causing them any sort of negative issues from that standpoint. Our pharmacists at Solevo were very highly trained on kind of the academic and the just general knowledge of marijuana as a medicine, getting down to the cannabinoids, getting down to the terpenes, these basic parts of the plant that we want to know and understand fully so that when we do make a recommendation to a patient, we can very confidently and comfortably do so and know that we're pointing them in the right direction. At Solevo, our intake paperwork, it actually feels very much like you're going to a physician's office. Our whole focus is on a patient's health history. Yes, we want to get an established diagnosis. We want to know if it's PTSD. We want to know if it's anxiety. Even if it is something else, even if it is chronic pain, for example, oftentimes those patients are very stressed, very anxious, oftentimes very depressed. All these kind of things that would fall under the umbrella of a mental health diagnosis anyhow. The pharmacist is going to review that health history. We want to know what symptoms you have, where you've been, things you've previously tried to treat your condition. We want to know what medications you're on. Be sure there's no serious interaction or any negative kind of expectation or anything we could potentially foresee and hopefully avoid. We also very much want to establish a rapport with our patients on that one-on-one first consultation. We want to gain your trust. We kind of want to prove ourselves that we do know what we are talking about, that we know that when we make a recommendation, we are confidently doing so, and pointing you in a direction that not only do we know from studying the medicine, but also from treating patients on the front lines every single day. We want to establish what a patient's even comfortable with. If you don't want to inhale marijuana, that is completely fine. We have plenty of other options we can talk you through, and all of them, walking through them, we can find something that will be appropriate. More often than not, actually, our patients are kind of fed up with taking pills. They're kind of sick of a traditional marijuana regimen. They'll do anything else except another pill. That's fine. We have plenty of options to talk them through. We want to set some goals of therapy and some expectations. We need to know when they're taking this medicine. If they're taking something solely at bedtime or they're taking it throughout the course of the day at work, those are going to be drastically different recommendations there. And as Sarah was saying, we need to get a sense at the dispensary what they are actually experiencing. My recommendation for someone with a generalized anxiety or a generalized condition is going to be very different than my recommendation for someone that has a specific phobia that's triggered by something maybe unexpected, a symptom I need to get them quick relief. Those are different considerations we're going to take into account on that first meeting with the patient.
So there's a couple things that you said I wanted to just touch on and amplify. First is that you require first-time patients to come in and have a meeting with a pharmacist. Not every dispensary does that. Is that right?
That is correct. Okay. So in Pennsylvania, the law states there needs to be a health professional on staff. It needs to either be a physician or a pharmacist, or potentially a physician assistant or nurse practitioner. The health professional is required to be there. However, it is not clearly spelled out as to what they should or should not be doing. As I said, Solevo's standpoint is very pharmacist and patient focused. That first consultation is really the core of what our business is built on. Again, we want to have that interface with the patient, start to build that relationship and that rapport with them, and just kind of go from there, make the best recommendation we can, and proceed with their treatment.
The other thing that I think you said that is very important is that you want to ensure that you don't create more anxiety in people who are there to treat their anxiety. I mean, it can be pretty intimidating the first time you work, even for me who's had a little bit of experience with cannabis. When I first walked into a dispensary, it's kind of intimidating. That can create some anxiety. Is there specific things you do for people with the mental health diagnoses that is a little bit different than the pain diagnosis or something like that?
Certainly. We definitely recognize that patients do come to us not only with a diagnosis, but actively experiencing some level of anxiety just walking through our doors. Again, we're almost this foreign entity. The names of some of the products look strange to people. You know, just the number of variety looks very kind of intimidating to people. And oftentimes people walk through that door and they just feel this unneeded pressure, like they need to be the expert. They need to know what they're doing. They need to have some level of confidence of even what they're talking about. With us recognizing that, it's very important that we kind of always reiterate to these patients, we are there for them and with them. At Solevo, you're never going to be by yourself. You know, we're never going to hand you a piece of paper with our inventory and say, what do you want? That is 100% not how we are going to operate. Some things that do set us a little bit apart. First of all, our consultations occur in a private office that is one-on-one with the pharmacist. So very heavy on patient privacy. And again, we want to have a very transparent and open conversation with these people to get things started the right way. That's one thing we initially offer to try to ease people into things. You're not off the bat, you're not in a big room, you know, trying to talk over a lot of noise or talk over other people with some kind of not full level of privacy there. We actually have a sensory friendly room that we can always use if we need to. So if we are particularly busy, if there's a lot of people in the waiting room, if it happens to be noisier or a little more chaotic than any other day, if we can kind of pinpoint and identify someone that seems to be struggling a little bit, that room is always going to be there as an option for them to kind of get them isolated a little bit, get them comfortable, get them in a spot where they just feel a little safer. Proceed to meeting one-on-one with the pharmacist at that point and then proceeding from there. But we're always going to bend over backwards to keep that in the front of our minds to make it a very comfortable and safe experience for the patient.
And the other thing you said is, you know, and it's true that you can walk in there and there's 2 or 3, 4 pages of different products. What's the process that you go through with each patient to find the right medicine and find the right dosage?
So as I'm walking through a health history with someone, part of that is going to be a little bit of their social history. Have they used marijuana previously? Are they comfortable with these products, with the names, with the dosing, those kind of things? If I can pinpoint an individual that's a little bit more experienced with marijuana versus someone that's brand new, those are going to be drastically different discussions. Even the people that are experienced, more often than not, do want some level of guidance. And there's always some level of new education we can provide for them. But oftentimes, those patients just need a little less care. They don't need followed quite as closely as someone that is brand new to this world. If someone has no experience whatsoever, we're going to start them at a very low dose on purpose. I tell this to every patient that I consult with. For the first few days, if you feel no effect at all, I've actually done my job as I should. I need to make sure I introduce this medicine safely and appropriately to a patient's system, and we can always build up from there. What I 100% need to avoid is a negative experience off the bat. I cannot have my patients over-medicated day 1 or day 2 or day 3. We can always build a dose as seen fit. As I said a little earlier, time of day plays a lot of role in a recommendation, in a direction a patient possibly may go. Obviously, something that's going to make someone very sleepy, they're not getting that while they're at work or throughout the course of the day. If someone's using the medicine solely at nighttime, that's a little easier recommendation. There's certain things I know I can go to automatically that should help not only with the mental health side of things, but also just help them get a good night's sleep and reap the benefits of what that can do alone. We're going to talk about ratios of cannabinoids. We're going to talk about building CBD into their regimen. We're going to talk about just kind of the practical administration. If someone has a really busy and hectic day, they might not have time to be kind of tied to their vape pen all day, for example. These are all things that we're going to walk through and kind of tease out a little bit through the course of the discussion. It's a little cliche, but I always say every single consultation is a little bit unique, and it's kind of depending on how the discussion goes. A recommendation could possibly lead in a few different directions.
Excellent. Chad Rodman. I like to say, don't get mad, get Chad. Maybe I'm the only one that likes to say that.
I think so, yeah.
You're tired of hearing me say it. Chad, you're here as a patient to describe things for us. Give us a little thumbnail of your biography and how you wound up here.
Sure. First off, thank you, Sven, for having me. So I'll start with my college days, I guess. It takes my 30-second spiel, right?
Yep.
So undergrad, I have my bachelor's degree in biology. Went and got my master's in public health. This is both at WVU. After that, I went and worked as an epidemiologist for the Center for Disease Control, where I was also published there. Went to med school for the first 2 years. Decided that wasn't the necessary path of medicine for me, so I came back to Pittsburgh here and was waiting around for the cannabis industry to take a foot. So I went and worked and did some research at Hillman's Cancer Research Center there, and it finally came. And here, then I started working actually at the Healing Center, where I was part of opening up the Washington location as well as the Monroeville location. And now I am a cannabis specialist here with the Compassionate Clinics of America.
And what are the conditions that you've been diagnosed with that you're using to treat used cannabis to treat?
Right. Definitely, my one is anxiety, and the other one I have some GI issues. So I always, it's more of like an IBS, but it's always chronic pain. So yeah.
So it's safe to say that medical cannabis has made your life easier.
100%. Yes, sir.
And how do you balance the consumption of that with being able to stay focused and being able to work a job?
Yeah, it's all about the ratios right now with the CBD and THC. For myself, I'm a little different. Given my GI issues and the anxiety, I actually go with some strains that are a little heavier for your normal patient during the day. So, I'm using a tincture or RSO, as it's called. It's Rick Simpson oil, if anybody knows about all that, right? I use some of that just a little bit during the day. And then if I have a spike or anything, or anxiety trigger, I'll go and I'll vape. But usually I'm pretty good with the RSO throughout the day.
Has your medical background made you a better patient?
Significantly. Not only can, I put my love of working with people and my love of cannabis, and I put them together. And this is what I do every day. So absolutely, learning all the mechanisms and intrinsic factors of the human body, and then you combine that with the endocannabinoid system, I love it. It's fantastic.
So here's a question we're going to ask everybody here. What strategies do you have for overcoming the stigma of cannabis and the stigma of the mental health issues? Let's stay with Chad on that one.
Yeah. I'd have to say, if I wasn't in this field, I mean, it would be extremely difficult. As I was an epidemiologist before, or even at the Hillman's Cancer, research center there, I couldn't come clean and say, yeah, I'm a medical, cannabis user. And now that I jumped over that fence, and now I'm in it full, for the all time, right? So. Yeah.
Sara, you're a mental health professional. How do you answer that question? How do you overcome those dual stigmas of both the mental health stigma and the cannabis stigma?
It's a really great question. One of the things that we always do is if we hear a patient say, I have anxiety, or I am anxious, or I am schizophrenic, we always let them know, you are a patient you are a person who sometimes suffers from symptoms of anxiety. And we really encourage patients to not internalize or label themselves with the condition. And I also feel like, being open and honest and talking about it and sharing your experiences with other people is very important as well, because this is something that's extremely common. And the more we talk about it, the more comfortable people are going to feel with getting help. And I feel like getting help is also another very important aspect of that as well, because as more people get help and they start to feel better, they'll want to talk about their positive experience.
I think it's a very important thing you said there, that you don't use that as a label. Like you don't say, I'm an anxiety patient, like you would say, well, I'm a diabetic. One of the things that you really impressed me with, full disclosure, I came to Sara to get my diagnosis for PTSD. And one of the most important things I think you said was, here's your written diagnosis. Now we're going to put this away, and we're never going to need to bring up that topic or that diagnosis again. We'll just treat you, the patient. Is that your attitude?
Oh, yeah, definitely. And actually, the more someone thinks about their diagnosis or the mental health condition, the worse it gets. So it's important to start to focus more of your thoughts and your energy towards healing and towards solutions and towards overcoming, instead of thinking more about the condition.
Yeah. Richard, how about you? Once people enter your dispensary, they've pretty much overcome a certain level of stigma just to walk in the door. But do you still deal with that issue, the stigma of both the cannabis and the mental health?
Absolutely. Believe it or not, almost daily, even though people have seen the physician, gotten the diagnosis, gotten their card, and come to see us, oftentimes people are still, the patients are still in need of a little bit of a pep talk. They want that reassurance that this is okay, that this is a legitimate medicine to use for a serious medical condition. I'm always there and kind of willing to give that pep talk. On a slightly, larger scale, I think just a big gap in this industry that we are definitely trying to and continuing to address is just the absolute lack of education, especially in a lot of healthcare practitioners. Unfortunately, some people already have their mind made up, and no matter how much you try, no matter how hard you try, or how persistent you are with educating someone, some people are just determined that they're right no matter what you say. I will say the more medical marijuana can be talked about, from many standpoints, you could talk about the research, you could talk about the science, You can talk about the cannabinoids, the receptors. You can talk about this on a very clinical and medical level. Oftentimes, the more impactful, discussions and stories, though, are actually the success stories. I can tell you about my patient that was 14 months old. I can tell you about my 2-year-old patient. I can tell you about all kinds of different success stories, ranging all the way up into a geriatric population that are now off of their opioids that they've been on forever. I really think highlighting the successes is a very, very, very important thing. Sometimes it's a chore, though. We certainly do our best. I like to talk to people. I love to hear the successes. I like to hear the criticisms, too. We're not perfect and we can do better. And that's what we're always going to try to do. But it's just kind of having that courage to have the discussion. This doesn't have to be like a negative. This doesn't have to be like a hush-hush, secretive type thing. If we're going to consider this a medicine, let's consider it a medicine. Let's compare it to an opioid or a Xanax or an antidepressant. Let's stop the comparison to alcohol. That's not the same thing. Let's stop trying to pretend that it is. So like I said, I try to do my best individually. I know Solevo tries to do their best as an organization, but more and more and more, it is just getting that accurate, correct, and appropriate information out there to the people that need it.
Chad, you were nodding quite a bit. Did you have anything you want to follow up with both of those things?
No, absolutely. Actually, with success stories, sharing them, I think that's a huge factor. Because people don't hear enough about the goodness that comes from the medical cannabis. I mean, like he's saying, we all have our stories that we'd love to share, but there's people that are here that went from 400 seizures down to 9 now a day. 9 seizures. I mean, that
would be a big day for a lot of people, but
right.
You're used to having 400.
Exactly.
Yeah.
Exactly. So,
describe how your quality of life before cannabis and today, comparing those 2 times in your life.
I mean, so I was in school, for the majority of it, but honestly, with my GI issues, I would not be able, most likely, not to work. You know what I mean? It was that bad, which causes the anxiety as well. They're, like you said, like we discussed previously, they come together. So yeah, definitely not able to. I could study and sit around and read my books all day and learn everything I could, but in order to really work and come out, wouldn't have been able to.
Sara, let's get back to you. Anxiety was just added to the list of qualifying conditions here in Pennsylvania. Mm-hmm. We saw a big spike in the number of patients that signed up with the state. Mm-hmm. You've told me that you've seen an increase in your business.
Yes.
Talk a little bit about what exactly is diagnosable anxiety, some of the common types. Mm-hmm. What makes it serious enough that we can actually come get a diagnosis?
Yeah, so with anxiety, this is kind of like a persistent and irrational fear. You have a really hard time with controlling your thoughts, controlling the worrying, and typically it's lasting for at least 6 months or longer. So this is something that is really debilitating. It can negatively impact different parts of your life, like with your career, your personal relationships. And the biggest thing that makes it a diagnosable condition is you basically have to fit all the criteria for it. So experiencing anxiety for the past 6 months or longer, having a hard time controlling the worrying, feeling irritable, having muscle tension, it not being caused by another medical condition, and it not being triggered by a substance.
Now, you've mentioned that it's one of the most easily treatable conditions. What other kinds of things do you do in your practice besides cannabis to help people deal with it?
So we have cognitive behavioral therapy, which is an evidence-based practice, which basically helps you to become more mindful and see what your thoughts even are. And we help you to think more positively and think less anxious and more positive thoughts. And we also have thought-fueled therapy, if the patient would like to try that, which basically combines acupuncture with therapy. So basically you think about whatever's making you anxious, and we help to reduce the negative emotion attached with the thought, because it's actually not the negative thoughts that make you feel anxious. It's the anxiety and the emotions that are uncomfortable. So we, by utilizing that, people become less anxious too.
And you're doing all this without any pharmaceutical drugs too.
Yeah. And we have a holistic nutritionist on staff. And so you can meet with her and, get different nutritional adjustments made. And another thing too with our anxiety treatment, and this is very not known, and I feel like a lot of people need to know about this. Every time you have caffeine, your body produces and releases cortisol, which is the stress hormone that's released every time you're anxious. So a lot of people don't know this, and they drink a lot of caffeine or they have a lot of Starbucks, and they wonder why their anxiety is so bad. We've had so many patients cut down on their caffeine intake, and their anxiety has gotten reduced significantly.
It's amazing.
Yeah.
It's amazing. Richard, how has the addition of anxiety to the state's qualifying conditions affected your dispensary business?
I think it's wonderful. Just from the standpoint of the program itself, huge point with adding anxiety to the list. That definitely opens this list up to numerous people that can benefit from this. On a day-to-day basis, you figure for probably the first year and a half, chronic pain was easily the number one diagnosis we saw. I would normally say upwards of about 2/3 of our patients were just for chronic pain. Now that anxiety is added, some days it feels like it's almost every single patient that comes in with that diagnosis specifically. So it's still new, but I think pretty obviously that will overtake chronic pain as our number one patient diagnosis, as long as we give it a little bit more time and keep seeing more of those patients. Sometimes it is difficult. I mean, all the 23 conditions, they're all very serious chronic conditions. So they're all a little bit difficult to treat. Anxiety can be a little bit tricky, kind of keeps us on our toes at the dispensary a little bit. We just want to be a little bit more cautious with the recommendations. A little bit more supportive, a little bit more reinforcement to those patients specifically because they are so vulnerable. But overall, I'm very happy that the state added that condition. From Solevo's standpoint, we have been busy. We're just a little busier now, it feels like. But from the day-to-day, it's definitely only a positive up to this point.
Well, it's funny you say that might be the number one. According to Dispense Magazine from the Relief app, shameless plug here, alert, anxiety is in fact the number one condition being treated by Pennsylvanians, and it lists out the top 5 products. And also depression is on here, stress, agitation, irritability, fatigue, a lot of mental health conditions that are in some ways related. Now, I've heard some people say, well, I've tried cannabis, but it actually, for anxiety, but it actually made me more anxious. Tell us what your strategies are to help people find that right dosage of the right product itself.
So if someone has tried any sort of medical marijuana previously with a negative experience, I want to do my best to figure out what that was and what caused it, and that can be very tricky. If someone was using a product off of like the illicit street market, oftentimes the patient has no idea what they had. They don't know what strain it was. They don't know what potency it was. They literally have no information tied to that. Even more importantly, on the illicit market, you're talking substantially more impurities. There's no testing, different fertilizers, the freshness of the marijuana. All these different things can play a part into worsening someone's anxiety. So oftentimes it's actually not even the marijuana itself. It may be some kind of chemical additive or some other issue, again, from a product that was not tested and did not come from a legitimate dispensary. If I am able to establish what the patient had used previously, obviously that's a little simpler. We can avoid certain things then. That's going to be my cue to head in a certain direction away from what they had tried before. If we have no knowledge other than, hey, I tried something and it was really bad. I was incredibly anxious and couldn't sleep, for example. There's certain directions we may go. There's always recommendations that are a little bit more safe. Generally, CBD as part of the marijuana plant or hemp plant, but we'll talk about the marijuana plant. Generally, that's a pretty safe recommendation. You're talking little to no side effects as long as it's the correct dose for most people. So we can always potentially explore a product that's a little bit higher in CBD. That's always going to be a little bit of a safer recommendation. Certain strains we're going to kind of automatically know to avoid. Again, at least to start, until we tease out a couple things and see what the response of the patient is to like our newest recommendations. I always find it interesting with the psychological diagnosis, particularly anxiety. More often than not, I hate to overgeneralize it, but patients can really oftentimes get relief from any kind of marijuana as long as the dose is appropriately minded, you know. Even if I'm going in the direction of a recommendation that of a strain that might be a little bit anxiety inducing, yes, common sense is going to say I'm going to try to avoid those. But if for some reason we are headed in that direction, the thing I need to stress to the patient is mind your own dose. We need to introduce that low dose, again, to not over-medicate and then potentially worsen some problems. Unfortunately, THC can be great for psychological. You know, it can help with depression. It can help with anxiety. It can help with many things. It can help with stress. But if you overdo it, one of the more common side effects is panic. So again, we don't want to over-medicate. It's all about minding the intake, how much the patient is actually getting. If we can do that in a milligram, we'll certainly start at the lowest possible milligram we can. Or if it's an inhaled form, we're going to counsel the patient as to how to do that appropriately and just start at that low dose.
Now, I know that in the state of Pennsylvania, the law says that if you get a dry plant flower from your dispensary, you are supposed to vape it. However, I've heard a rumor, just a rumor, that some people may actually still smoke it. What's your knowledge of, it's just a rumor, what's your knowledge of the process of burning the plant? Now, what I understand is it actually burns off a lot of the terpenes, and you can't really absorb them when you smoke it as opposed to when you vape it. And it's the terpenes that actually help kind of smooth out some of that possible anxiety causing effect. Am I on track with that?
Yes, that's a very dirty rumor you speak of. This is the first I've heard of such a thing.
I'm glad I brought you up to speed here. But does burning it actually destroy the terpenes, as opposed to if you actually get an oil or a tincture or that sort of thing?
That is correct. So I don't know the exact math, but I probably should. But when you actually ignite marijuana, like actually take fire to it and combust it, a lot of the actual cannabinoids themselves and the terpenes, no pun intended, literally go up in smoke. They're actually just kind of burned off into the atmosphere. So that is a consideration in terms if you're talking about a potency or even just a little bit more, just kind of getting your money's worth out of what you're actually purchasing. I don't want my medicine going to waste per se. Versus when you vaporize, there does tend to be a lot more of actual cannabinoids and terpenes consumed into the human body. The other thing about vaporizing dry leaf is you can set, on many devices, you can set the device to a very specific temperature. So you can actually, even on a particular strain of dry leaf, you can actually customize your own therapy. You can set a temperature where you know only certain cannabinoids will be released or certain terpenes will be released. And the more a patient is willing to or able to play with that number of the actual vaporizing temperature, again, you can kind of customize your own therapy a little bit. There's certainly going to be, health considerations to take into account as well. When you actually smoke marijuana, you're getting way more carcinogens, the actual cancer-causing agents of the smoke, higher levels of CO2, those kind of considerations as well. But just to be clear, legally, even if you have a card, you can't actually smoke marijuana in the state of Pennsylvania in terms of lighting it on fire.
Chad, you have some medical background and history. Do you want to expand upon that or what you know about that whole situation?
Yeah. I always look at my terpene profiles. That is a big thing, especially with what we're saying.
So the terms sativa and indica don't mean as much as the actual terpene profiles.
Those are old terminologies anymore. I really feel like you need to learn the terpenes. There's over 113 of them now.
So far
something
identified,
like that.
yeah.
Right. And those are all with different molecules that are found within cannabis, right? So, for instance, everybody loves lavender, right? Lavender has a phenomenal type of terpene. It's called linalool. Well, guess what also is found in cannabis? Linalool, right? So if you look at the benefits, of lavender, it's relaxing, calming, that sort of thing. Well, those cannabis strains that have that in it, same effects. So the patients really have to pay attention to the terpenes that affect them, whether it's positively or negatively. And this is a conversation that I also have to have with the patients that are coming to me with anxiety, because it changes the conversation. Mm-hmm. If you're looking at anxiety in general, I avoid particular terpenes. There's a pinene, for example, alpha and beta pinene. When you see high levels of that particular terpene, I tend to avoid that, because that terpene, just for me, elevates my anxiety. And everybody's different, but there are general rules of thumb. With that being said, and pinene is one of those general rules of thumb to stay away from. So.
Now, but that's also, I know it's true that everybody reacts to these terpenes differently. So you can start with a general guideline, but it's really up to each patient.
100%. And what I always do is, if they're going to try something that's brand new, I always say, have your normal dose and cut it in half. That and try it from that, try at that point and see if you,
Interesting. Yeah. Well, Sara, let's get back to you. Let's talk a little bit about the other mental health conditions. PTSD is a big one. We've done some podcasts in the past about this. Just give us a general outline of what causes PTSD and what are some of the symptoms that people might recognize in their behavior that maybe, hey, I gotta go get some help with this.
Yeah, so PTSD occurs after someone witnesses, observes, or learns about a traumatic event, and they start to then experience flashbacks. They have hypervigilance, which is trauma-induced anxiety. They can have a hard time sleeping. They can have GI issues.
I wish I had another question on that. Richard, you've said you love to share some success stories. Do you have any specific ones that you really like about people using cannabis with mental health issues?
Just generally, yeah. I mean, if you want to talk in more of a general sense, as a pharmacist, I don't necessarily like to badmouth traditional pharmaceuticals necessarily.
Go ahead, badmouth. We don't care.
But I am never cease to be amazed by when I see a patient that is exploring the medical marijuana route. More often than not, they're just frustrated with traditional healthcare. They have a med list that's a page and a half long. Just their medication load it's just unrealistic. It literally affects their life, just the taking of their pills. I have numerous stories of people either reducing or completely eliminating. Probably the biggest ones are benzos. So if we're talking like Xanax, Ativan, something like that for anxiety, numerous patients, again, see either a reduction, if not complete elimination of those. Another huge one is sleep meds. It's kind of similar discussion, but again, a lot of people are on very high doses of very serious medications with very serious side effect profiles. So more often than not, a patient is verbalizing to me, I just want off of my medicines altogether. I very much kind of want to support them in that and tell them that's a realistic goal. But again, we have to keep things realistic. I'm not going to eliminate your traditional medicine in one day. We might never totally eliminate something, but if we can cut your medication load in half or cut a pill in half or something like that, that is going to be a win. It never ceases to amaze me that when a patient starts on medical marijuana, that almost inevitably happens. If you're talking mental health, again, you're talking the antidepressants, the anti-anxiety meds, the sleep meds. We've also seen it with opioids. We've seen it with anti-inflammatory drugs. There's a whole list you could go through. Although I'm a pharmacist, oftentimes I love to see and hear about those success stories because so much of the time that's the patient's goal. They just want a little bit of freedom from their traditional medicine. We've had patients come in on disability. We've gotten them back to work. Even if not full-time, if we can get them back on a part-time basis, that can be a win. Substantial reductions in depression. People are willing to leave their house. They're willing to engage. They're willing to go to social events. They're willing to do different things and just kind of gain some level of just functionality, just general quality of life back. And it's always, like I said, it's always amazing for me to see unfolded in front of my eyes.
Chad, as a patient, what do you think are the most important questions that patients should ask their family doctor about cannabis?
Yeah, it's sad, but some of them just aren't informed enough. And to ask them, I would have to maybe say ask, all your practitioners, right? So not even the PCP, but maybe
the specialists.
And also the cannabis specialists as well. To really to dive into that.
Do you have any strategy for when a doctor says, "Well, I don't believe in cannabis"? I always love that one. It's like saying I don't believe in gravity, or there's not enough research.
I mean, granted, there isn't enough research on certain facts, okay? But yes, the majority of them are facts. And it's like you were saying before, it's hard if somebody just does not want to change their mind and listen to the facts.
Yeah.
Well, what do you do at that point? But to have an educated conversation with a person is always always the greatest idea to me, because everybody learns. I learn every single day, So if you can learn one thing, and especially if it's about medical cannabis, I think that's always going to be a positive outcome there,
Sarah, how about for you? The same two questions. What are important questions for patients to ask their doctor? And if the doctor says, I don't want to know anything about it, do you have any strategies to help patients out?
Yeah, definitely. So it's really important to be open and honest with your healthcare providers and let them know what's going on. If you're interested in using medical cannabis and your healthcare provider doesn't support it, you are able to get a new healthcare provider.
Yay.
Yes, you are empowered to choose whoever you want to see, and you're paying your doctor or your healthcare provider's paycheck every single time you go. So you have the right to get a new healthcare provider. You can always have your medical records faxed or sent to the new provider. And you can, go ahead.
Well, I was just going to say, because there have been, again, just a rumor, but there have been circumstances where physicians say they won't release medical records if it's going to go to a certifying physician. That's not legal, correct?
Yeah, but we see clients every single day who have previously seen healthcare providers who do not want to release those medical records. So,
Richard, do you have any good strategies for that? How do you deal with difficult doctors?
Yeah, so I'm going to kind of echo what they both said. The transparency is important. You should not be ashamed to be using medical marijuana and pursuing that route for your own therapy. Have the discussion with your providers, your healthcare providers, and have the discussion with all of them. If it's a PCP, if it's a specialist, if you're going in for surgery, it's just very important that people know this, not only for the patient's actual health, but again, we're really starting to chip away at that stigma. I actually gave a presentation about 2 weeks ago to a group of dentists, and they were kind of joking about it too. Marijuana use isn't new. What is new is people actually disclosing it, So often we treat marijuana like it's this different new thing. People have been using marijuana for thousands and thousands of years. People have been self-medicating all the time, if we're going to be honest. Again, think transparency. You don't have to be ashamed about this. All your healthcare providers should know. If you're dealing with a particularly difficult physician, the first thing I would say is those are your medical records. They're not the doctor's. By law, they do have to release them to you. So just being practical, let's say you had a PCP who was being particularly difficult because they didn't want to send the records to a medical marijuana certifying physician. Okay, that's unfortunate, and it's actually illegal, but fine, give me my records then, and what I do with them, I'm physically going to take them to the certifying doctor. Simple as that. You're almost cutting out that issue or that discussion. There is no way, shape, or form that you should not be able to get your hands on the records from any sort of healthcare provider. The other thing I always tell people, use the resources that you have as a patient. What I mean by that, if you're under UPMC's umbrella, log on to my UPMC and print or download your records from there yourself. The same with Allegheny Health Network also has a patient portal where you can do the same thing. So again, you can, to some extent, if needed, you can take control of the direction of this yourself as the individual patient.
Well, we're just about out of time, and I wanted to just close with letting each of you tell us what kind of words of encouragement do you have for patients to say, for people dealing with mental health issues? Life is already looking much more difficult. What are some words of encouragement that you would have to say, yes, there is a light at the tunnel, and it's not just a train coming at you? Chad, do you want to start?
I have one saying. Life is 10% what happens to you and 90% how you react to it. It's about your attitude and your perspective on everything, and medical cannabis helps with that.
Great. Sarah, what's your words of encouragement?
There definitely is hope. It is much more painful to not seek out help and to not seek out treatment than to seek it out. And you deserve to feel better, and you deserve to heal, and to please move forward in the healing journey and find a mental health provider that you feel comfortable with.
Excellent. Richard, your last words of advice?
My biggest words of encouragement or advice would be you're not alone. Mental health is a huge topic in healthcare right now. It's a huge problem in our society overall. Again, I'm not going to bash traditional pharmaceuticals. They have a role. Medical marijuana has a role. Even those individually are not the cure-all, though. I encourage people, use any and all resources you can. Get counseling. You can work on your nutrition. You can do something social. You can try to work out if possible to improve your mood. There's all kinds of avenues that you can possibly pursue to improve your mental health. That's one thing. Oftentimes there's a lot of pressure. People come to us and say, I'm at the dispensary because this is my last resort. It might feel that way, but there's always options. There's always support. You are not alone. People with mental health issues, they don't need stigmatized. They don't need demonized. They need our support. Honestly, we all need each other's support. So my biggest thing is you're never alone. There is always going to be an avenue for some level of improvement overall.
Excellent. Okay. Richard Greer, Sara Makin, Chad Rodman, thank you so much for being with us today.
Thanks for having us.
Thank you.
Thank you.
That's it for this episode of the Dispense Magazine podcast. You can find out much more about this topic and other podcasts featuring Sara Makin and Richard Greer on our website. You'll find plenty of podcasts and articles, plus a free online database to help you find a certifying physician or dispensary near you. You can find print copies of our magazine in every Pennsylvania dispensary, as well as doctors' offices, holistic centers, and retail locations across the state. To find out where or to read a copy online, visit dispensemagazine.com. I'm Sven Hosford. Thanks for listening. This has been a production of Dispense Magazine, LLC.